She woke up at 3 a.m., drenched in sweat. The sheets were soaked, her pillow was cold and damp. She thought it was just the weather, maybe stress, maybe menopause returning after all these years. So she changed her night clothes, drank a glass of water, and went back to sleep. She did this for 7 months, 7 long months, until the day her doctor looked at her scan, lowered his voice, and said the words no one ever wants to hear. "I'm afraid we've caught this late." Her name was Margaret. She was 58 years old, a grandmother, a retired school teacher from Ohio. And the very first sign that cancer was quietly growing inside her body didn't appear during the day. It didn't appear in pain. It didn't appear on any blood test she had taken that year. It appeared at night. And what doctors are now warning, what oncologists across America are quietly admitting in clinics and hospitals, is something most people have never been told. There is a specific symptom, a strange, silent, easy-to-dismiss symptom that often shows up in the dark while you sleep, months and sometimes years before any official diagnosis. Most people brush it off. Most people Google it once, get reassured by a random forum post, and never think about it again. And that's exactly what makes it so dangerous. Because by the time the daytime symptoms arrive, the weight loss, the fatigue, the lump, the pain, the disease has often already begun spreading. The night, doctors say, is when your body whispers first. And tonight, in this video, I'm going to show you exactly what that whisper sounds like, what it feels like, and the 3 terrifying patterns that doctors say almost everyone ignores until it's too late. I'm going to walk you through what's really happening inside your body when this symptom appears. I'll reveal the biggest mistakes people make when they first notice it, mistakes that have cost thousands of lives. And I'll share what leading oncologists now recommend you do the moment you experience it, even once. If you're over 40, if you have a family history, if you've ever woken up in the middle of the night feeling something just wasn't right, please don't skip a single section of this video, because what you're about to learn could be the most important health conversation you've had this year. Stay with me. This one matters. So what is this symptom? What is the nighttime warning sign that doctors keep seeing again and again in patients who are later diagnosed with cancer? It's called drenching night sweats. And I don't mean a little warmth under the covers. I don't mean waking up feeling slightly hot in July. I'm talking about the kind of night sweats that soak through your pajamas, soak through your sheets, and force you to get up and change clothes, sometimes twice in one night. The kind that happen when the room is cool. The kind that have no clear reason. The kind that keep coming back, night after night, week after week. But here's where things become frightening. Night sweats themselves are not always cancer. Of course not. They can come from menopause, from infections, from certain medications, from anxiety, but there is a specific pattern of night sweats that oncologists call a B symptom, and when it appears alongside other quiet signs, it becomes one of the earliest known warnings of cancers like lymphoma, leukemia, certain liver cancers, and even some advanced solid tumors. Why does this happen at night? Why does the body whisper in the dark? Here's what researchers discovered, and it shocked even seasoned doctors. While you sleep, your body enters a state of deep repair. Your immune system goes to work. Hormones shift. Your core temperature naturally drops. And when there are abnormal cells multiplying somewhere inside you, cells that shouldn't be there, your immune system fights them most aggressively during these night hours. That fight releases something called cytokines, tiny chemical messengers that cause your body to overheat, to sweat, to wake up soaked. In other words, the sweat isn't the disease. The sweat is your body's silent war against it. And most people never connect these symptoms. They blame the thermostat. They blame the season. They blame their partner. They blame stress at work or a glass of wine before bed. They buy cooling pillows. They open windows. They turn on fans. And the body keeps whispering, louder and louder, while the person keeps explaining it away. There's something else doctors have noticed. Often the night sweats don't come alone. They arrive with quiet companions, small symptoms that seem unrelated. A mild itch on the skin that won't go away. A swollen gland in the neck or armpit that doesn't hurt. Unexplained fatigue that no amount of sleep can fix. A loss of appetite that creeps in slowly. A few pounds lost over a few months without trying. Each one, on its own, looks like nothing, but put them together, especially with those night sweats, and you have what oncologists call a constellation, a pattern the body is begging you to see. And here's the part that really keeps doctors up at night. Studies have shown that some patients later diagnosed with aggressive cancers had been experiencing night sweats for up to 2 years before their diagnosis. 2 years. 2 years of warnings, 2 years of opportunities, 2 years of moments where, if someone had just connected the dots, treatment might have started when the disease was still small, still beatable, still early, but almost nobody notices this in time, and that's what we have to change. Now I want to talk about the mistakes, because this is where lives are won or lost. These are the patterns oncologists see again and again, and every single one of them is preventable. Most people think night sweats are just a normal part of getting older. After all, menopause causes them. Andropause in men can cause them. So when a 55-year-old, a 60-year-old, a 70-year-old wakes up sweating, they shrug. They tell themselves, this is just what happens now. But here's the truth. Your doctor wishes more patients understood. Menopausal night sweats follow a predictable rhythm. They fade. They respond to hormone changes. The dangerous kind, the kind linked to disease, get worse over time, not better. They don't respond to fans or open windows. They come even when hormones are stable. If your night sweats are intensifying instead of fading, that is not normal aging. That is your body asking for help. This is the most heartbreaking mistake of all. People notice the symptom. They feel something is wrong. And then they tell themselves they'll wait a month. Then another month. Then another. They don't want to bother the doctor. They don't want to seem dramatic. They don't want to spend the money on tests that might be nothing. And while they wait, the cells inside them keep multiplying. Oncologists will tell you privately, the difference between catching certain cancers at stage 1 versus stage 3 is often just a few months of delay. A few months that could have been used. A few months that, if used wisely, could have meant a cure instead of a fight for survival. This one surprises people. Many patients go to their doctor, mention the night sweats, get a basic blood panel, and are told everything looks fine. They breathe a sigh of relief. They go home, and they never bring it up again. But here's the scary part. Standard blood work often misses early-stage blood cancers and many solid tumors entirely. A normal CBC does not rule out lymphoma. A normal metabolic panel does not rule out liver involvement. If your symptoms persist, one clean blood test is not the end of the conversation. It's the beginning. You may need imaging. You may need specialized tests. You may need a referral. Don't let one piece of paper close the door on your own instincts. Remember those tiny symptoms I mentioned? The painless lump, the itch, the fatigue, the unexplained weight loss. People notice each one in isolation and dismiss each one separately. The lump is probably a cyst. The itch is probably dry skin. The fatigue is probably stress. The weight loss is probably the new diet. But when you connect them, when you sit down and write them on paper together, they tell a different story. Doctors are pleading with patients to start tracking their symptoms. Write them down. Note when they started. Note how they've changed. Bring that paper to your appointment. It could be the most important document of your life. This one might surprise you, but it costs lives every year. Many people experience night sweats and never mention them to their spouse, their adult children, anyone. They suffer in silence. They handle it alone. They don't want to worry anyone. But families are often the ones who push for second opinions. Families are the ones who notice the weight loss you can't see in the mirror. Families are the ones who say, "Mom, this isn't right. Let's go in together." Silence is not strength. Silence is the disease's best friend. Speak up. Tell someone who loves you. These 5 mistakes are the difference between catching this early and finding out too late. So what do you actually do? If you've been listening to this video and your stomach has been turning a little, if you've recognized yourself in some of these patterns, here is exactly what leading oncologists in the United States now recommend. Get a small notebook. Keep it by your bed. Every morning, write down whether you had night sweats, how severe they were on a scale of 1 to 10, what the room temperature was, and how you felt overall. Note any other small symptoms: fatigue, weight, appetite, any lumps, any itching. After 2 weeks, you'll have something concrete, not a vague feeling, real data. Doctors take data seriously, so should you. Step 2, book the appointment and use the right words. When you call your doctor, don't say, "I've been a little warm at night." Say this instead: "I'm experiencing drenching night sweats that soak my clothes and sheets, and they've been happening for several weeks. I'd like to be evaluated for systemic causes." Those words matter. They signal urgency. They tell the front desk this isn't a routine concern. They get you seen faster, and they get you taken more seriously. Step 3. Ask for the right tests. Beyond a standard blood panel, ask your doctor about a comprehensive workup. That may include an inflammatory marker test, a lactate dehydrogenase test, thyroid function, and possibly imaging like an ultrasound or CT scan of the chest, abdomen, and pelvis. If you have any swollen lymph nodes, ask whether a biopsy is appropriate. Don't be afraid to advocate for yourself. The patients who survive are often the patients who asked one more question. Step 4. Strengthen your body now. Whether or not anything is found, the habits that protect against cancer are the same habits that protect against almost every chronic disease. Build your plate around colorful vegetables, leafy greens, cruciferous vegetables like broccoli and cauliflower, brightly colored berries packed with antioxidants. Include fatty fish like salmon a few times a week for omega-3s. Drastically reduce ultra-processed foods, sugary drinks, and processed meats. The evidence connecting processed meats to certain cancers is now considered very strong by major health organizations. Step 5. Move every single day. You don't need a gym, you don't need a marathon. 30 minutes of brisk walking a day has been associated in study after study with lower cancer risk and better outcomes for those already diagnosed. Movement boosts immune surveillance. It reduces inflammation. It helps regulate the very hormones that, when out of balance, can fuel abnormal cell growth. Step 6. Protect your sleep. This is one most people overlook. Deep, consistent sleep is when your immune system does its most important repair work. Aim for 7 to 9 hours. Keep your bedroom cool and dark. Avoid alcohol before bed. Alcohol can actually trigger night sweats and mask the warning signs we just discussed. Cut screens an hour before sleep. Your body cannot fight what it cannot rest enough to fight. Step 7. Stay current on screenings, mammograms, colonoscopies, skin checks, low-dose CT scans for long-term smokers, prostate evaluations. These screenings exist because they save lives. Full stop. Talk to your doctor about which screenings apply to your age, your sex, and your family history. Skipping them to save time is one of the most expensive decisions a person can make. Step 8. Know your family history. Sit down with your parents, your siblings, your aunts and uncles while you still can. Ask what cancers run in the family. Ask at what ages they appeared. Write it down. Bring it to every doctor's appointment for the rest of your life. Genetics don't determine your fate, but they shape your roadmap. And in some cases, they unlock earlier screenings that could save your life. Step 9. Build your support system. Tell one person you trust about what you're noticing. Just one. That person becomes your accountability partner, the one who reminds you to keep the appointment, who drives you to the test, who sits with you for the results. Healing, prevention, survival, none of it happens alone. Each of these steps is small. Each one is doable. And together, They form the most powerful early warning system you can build for yourself. I want you to hear something, and I want you to really let it land. Your body is not your enemy. Your body is your earliest, most loyal messenger. Long before any machine can scan you, long before any blood test can detect a single cell, your body knows, and it tries to tell you. In small ways, in quiet ways, in sweat-soaked sheets at 3 in the morning when the world is asleep and nobody else is listening. The people who survive are almost always the people who listened. Margaret, the grandmother from Ohio I told you about at the beginning, her story didn't end in tragedy. After her diagnosis, she fought. She had support, she had treatment, and today, 3 years later, she still wakes up sometimes in the middle of the night. But now it's not from sweats, it's from gratitude, because she promised herself she would never ignore her body again. And she's still here to keep that promise. You can be Margaret. You can be the one who notices. You can be the one who acts. You can be the one who writes it down, makes the call, asks the question, and walks out of that appointment with answers instead of regrets. Your body whispers before it screams. Don't wait for the scream. If this video moved you, if it made you think of someone you love, please share it with them tonight. Subscribe to Dr. Ethan Care so I can keep bringing you the warnings, the wisdom, and the hope that could one day save a life, yours or someone you cherish. I'll see you in the next one. Take care of yourself, and please, listen to the whispers.